Hi, my name is Paige Hanson, and I am applying for Weber State's DNP Family Nurse Practitioner program. And when I began my healthcare journey, I had just finished my bachelor's in exercise science and all the prereqs to get into PA school, and I just needed more hours for my application. So I started working as a CNA, and I did assisted living, I did home health care, and then I got a job inpatient at Primary Children's Hospital on the neuroscience and trauma unit. After working inpatient, it opened my eyes to how much more there is within healthcare. I had no clue what it meant to be a nurse. I did not want to be a nurse until I saw how much growth and opportunities nurses had. After working there about 10 months to a year, I had the opportunity to be 1 out of 10 Intermountain employees to be sponsored through nursing school. And when I got accepted, I actually cried because I didn't want to be a nurse. But I've never been more grateful for my backwards path that brought me to nursing, and I'm so grateful to be a nurse. Since obtaining my RN license in 2018, I have been practicing as a bedside nurse at Primary Children's Hospital on the neuroscience trauma unit and am now a charge nurse. The more time that I spend with my patients, the more I am dedicated to the improvement of healthcare, especially within my own community. I've learned how powerful and influential nurses can be as advocates for the lives that we care for each and every day. Through bedside nursing, I have learned to care immensely for my patients that I don't know, and that will transition into my role and practice as a family nurse practitioner. Because of my path to nursing, I know that I want to be a family nurse practitioner. I have the support from my family I need, as well as the continued opportunities and experiences from work to learn that will allow me to succeed in Weber's competitive DNP-FNP program. Recently, I cared for a child that had a grade 5 liver lac, and the parents had no idea how severe this case was. I was talking to them during their 4th week in the hospital, and they were telling me how when they were flown into the hospital, they had no idea how urgent this case was. They thought that we all had 2 livers, and well, he just damaged 1, so he had a 2nd liver that would fill in and help him bounce back quickly and lead a healthy and normal life. I want to be able to start from the beginning. My goal is to continue in the pediatric setting as a pediatric family nurse practitioner and be able to educate parents from the beginning how to be the best advocate and caregiver for their child. Those parents were blindsided when they were told that their child might not make it in the beginning and had no idea the road that they were just about to embark on. I want parents like that to be prepared. Instances like this happen weekly, and I want to create a change. And as a family nurse practitioner, I can create that change. Weber's hybrid DNP-FNP program will allow me to reach out deeper into my community. The DNP degree allows me as a nurse to advance my practice through research and practice-focused learning. By completing a DNP program, not only do I enhance my own clinical skills, but it will help me create a better foundation for understanding evidence-based medicine and applying it to my own practice, which will translate to my patients. Evidence-based medicine is the highest quality of research, clinical expertise, and patient preference. Through finding quality research, I can interpret and help better educate my patients to help make the best decisions possible for their lives and their health. Family nurse practitioners practice patient care at the highest level of nursing and allow the delivery of healthcare to be more accessible to everyone. Throughout the FNP program, I will have mastered the 9 core competencies that will allow me to perform the full scope of practice as a licensed independent practitioner. As a family nurse practitioner, I have the ability to help people through every stage of their lives, from prenatal to death. I will be able to help manage acute and chronic illnesses and intervene appropriately to ensure optimal health and wellness to all of my patients. I will be able to continue to work with families to implement healthcare plans and provide preventative care. As a family nurse practitioner, I will have the education I need to better myself, my family, and my community. Thank you so much for this opportunity.